Hey everyone, and welcome to this special bonus interview for the Hormone Optimization Masterclass here at Rebel Health. I'm your host, Michael, and I am joined today by Dr. Mark Sklar. Dr. Sklar, welcome.
Thanks for having me, Michael. I'm excited to chat with you today.
Yeah, it's so fun. I love having new folks on that we've not interviewed or collaborated with before. And I found you on a different hormone event last year and really enjoyed your content and did a little digging. And it was exactly what we needed to round this out and bring in a topic that I think is really important when we're talking about hormones. And a lot of the presentations get into fertility, is Chinese medicine. And it's kind of it's like the kid on the outside watching the functional medicine party, I feel like, in some circles. And it probably is like the original functional, like it's,
It is, yes.
did I just use a thing you say? That was not
No,
scripted, but it's,
no, not at all.
I love how conventional medicine and like mainstream medicine tends to refer to like functional medicine, Chinese medicine, naturopathic medicine as alternative. And all of those approaches have been along the naturopath, the traditional healing, the traditional Chinese medicine are all vastly older than what we consider like conventional. So I get a kick out of wordplay there, but we're going to get into it in a minute. I want to give you an introduction for anybody who's not familiar with you and your work. Dr. Mark Sklar is the fertility expert, a natural fertility specialist helping couples get pregnant for 21 years. His mission is to help you feel hopeful and confident about your fertility journey again. And in addition to Doctor of Acupuncture and Oriental Medicine, he's trained at Harvard Medical School, Mind Body Medical Institute. He's a creator of Fertility TV, marksklar.com, and reproductivewellness.com, and a fellow of the Board of Oriental Reproductive Medicine and medical advisor for Symphony Natural Health. He has online programs and also supports his community via the YouTube channel Fertility TV, which is pretty awesome, where he shares information-packed videos to educate his followers on all things fertility. And he lives where I used to live in San Diego, wife and 2 sons, and he has his clinic there, Reproductive Wellness. He also works with couples around the world through online coaching at the Hope Fertility Program. So you're a busy guy. And before we came on, we were talking about how I miss tacos in San Diego. But let's just jump in and traditional Chinese medicine is something I've had like a personal fascination with since my first experience, which was close to, I don't know, 12 years ago now. And it's something that comes up in conversations around fertility. Often if somebody's like, tried everything, they might end up at the local traditional Chinese medicine person for hormones, fertility. How did you end up becoming a doctor of acupuncture and Oriental medicine? Where did your interest come from?
So it's an interesting journey over time. From a young teenager to a young adult, I had several episodes of digestive issues, and I could probably recall from like 11 or 12 till about 21 ish. So let's just say 10-year run of ongoing digestive issues off and on. And really, when I asked my parents or I complained, it was, let's just take you to the pediatrician. Let's see what they say. They diagnosed me with some sort of itis. And then they just said, okay, it was appendicitis. Let's do surgery. You've got pancreatitis. We'll just, give you some medication. And I wasn't feeling any better. And I would have moments where I did feel better. And so then I would forget about it like we naturally do. And our tendency as humans are, and we just kind of move on. And then I'd have another setback. And when I was in college and I was 21 and I had this bout of what they diagnosed me with was pancreatitis, but at the time I said, okay, that's what it is. I'm not sure. Since then, I've somewhat questioned it as I've learned a little bit more. But one of my cousins was always, when I would talk to her about what was going on, and she was older than me, she would say, oh, you should go see an acupuncturist. I was like, I don't know. And I don't really have a reason to go see an acupuncturist. And so I found myself in the hospital with what was called pancreatitis, and I was fed up. and I was just frustrated, and I knew that I needed to do something different and make a change. And so, 3 days later, when I got out, I searched for an acupuncturist. And I was in college, so I wasn't home and I didn't really have resources. So I just searched for somebody. And no one I knew was seeing an acupuncturist, so I couldn't really get a referral. And so I went to see her for the first time. And I remember laying on the table and I started to feel like I was floating. And I was just having this weird experience that I just couldn't explain. And when I left, my stomach pain was gone. I felt like I was on cloud nine. I felt like all energized and good and happy. And I said, well, maybe there's something to this. And, I continued to go back and I just got better and better. And when I went home, I saw an acupuncturist at home who is the person who I call my acupuncturist now, and who I would, say this was the woman who really influenced me. And I came to realize that the person I was seeing at college was actually not very good at acupuncture, but it speaks to the medicine, like how powerful it was, because someone who wasn't as trained, didn't have a lot of experience, it was still a profound experience for me and results. And so I studied lots of different things in undergrad, and one of which was pre-med for a period of time. But I didn't know what I wanted to do when I graduated. And my acupuncturist back home in Miami said to me, she said, why don't you think about going to Chinese medicine school? And I said, that's an idea I never thought of. And one thing led to another. And I ended up in San Diego going to acupuncture school a few years later. And I never looked back. I said, what was I didn't know much about it other than my experience. And I said, well, what's the worst thing that could happen? I go check it out for 6 months or a year. If I don't like it, I just stop and I go do something else. And I never stopped. And I
guess you liked it.
I did. Yeah.
Did you go to Pacific, or is it
I
Pacific?
did.
Pacific.
Yeah.
Yeah. That's interesting. I had a friend who went there when I was living there, and I got to be the guinea pig on a lot of student sessions, which are
nice.
There's pros and cons to that. But like you said, I still saw benefits, because like they might not have been as skilled, but it still felt pretty good. And I'm not going to tell my whole first acupuncture story, but I also experienced the floating, and I came from a place of anxiety with it. So I'm speaking to anyone out there who's scared of needles like I am. I didn't want to do it at all. And I was kind of desperate for a couple of reasons too. And I'd read an article and it interested me. So I'm like, I'll try it. Can't be that bad. The needles are tiny. And it wasn't that bad. And then for me, it was after. On the table, I was pretty chilled out. But then I was like getting dressed. And like she was telling me stuff that I was supposed to follow up with or something. And I noticed I wasn't really paying attention. And I was kind of just like a little out of it, but not in like a bad way. I just kind of in a, I don't really care right now sort of way. And then I just left. I was like, I'll email you. And then I was walking down the hallway to the elevator. I was in downtown Chicago. And I just remember being like, are my feet going? Like, okay, my feet are going. I felt like I was just on the, like in the movies where the camera's just even level, like, yeah, right to the elevator. And I had a lot of anxiety at the time. I had a lot of mental health challenges at the time. And I like felt none of that for the first time, I don't know, and maybe ever, but and it felt so foreign. And I was like, I need to learn more about this and do this some more. So that's cool. And it's so many times I ask practitioners, like, how'd you end up in this specialty that you have, or how'd you end up in this training or what? And it almost always starts with, because I needed it myself and I experienced it myself and seemed like the thing to do. Either I had to learn so much about this subject to get myself well that the only logical step from there was to start teaching other people, or this modality helped me a lot and I want to help others and do it. So I guess that brings me to my next question. And we talked about acupuncture, but traditional Chinese medicine isn't just acupuncture, right?
Correct. Yeah. Acupuncture is a modality or therapy within the bigger picture of what we classify as traditional Chinese medicine.
What are some other tools or modalities? I know there's herbs.
Yeah, so the two main tools that are used in most practices and most in the States, most people, when they say I went to acupuncture school, they really went to Chinese medicine school. And most will learn all the modalities. There are some few colleges that allow you to just focus in on, oh, I just want to be an acupuncturist. I don't want to do herbs or anything else. But in general, if someone says they're an acupuncturist, because that's the way they're labeled in the United States as a licensed acupuncturist in most places, or acupuncturist, um, most of the public know us as acupuncturists, but yes, we do much more. And within the bigger scope of Chinese medicine or traditional Chinese medicine, acupuncture and Chinese herbs are the two main modalities. And then there is Tui Na, which is a form of massage. There is, within hopefully all medicine, there's dietary and lifestyle recommendations, and ours can be a little bit different just based on Chinese medical theory. Those are probably the bigger ones. There's cupping and moxibustion, which others have, probably heard of, especially cupping. Probably been more prominent, especially with
Thanks
the
to the
Olympics.
Instagram also.
And right, and it's yeah, exactly. Yeah, so
Yeah.
those are the main ones, and actually in China, you are either going to study and become an acupuncturist, an acupuncture doctor, which is acupuncture and moxibustion together,
Hmm.
or you are going to study herbology. And those are actually two totally separate fields of study in China.
Interesting. Okay.
Yeah.
I had a great guy in Ocean Beach when I lived in San Diego, and he used the acupuncture with the moxibustion, and it really did a number. I had like an injury, and it helped so much. Like
Yeah.
fast, I healed so much faster than I thought was possible, and he started getting into some of the science of it, and that the moxibustion, it's like I don't know how to describe it. It's like almost like a burning incense.
Yeah, it's kind of like that. It's an herb, actually a weed that you can find in many places in San Diego. It's all over the road. It's mugwort,
Okay.
and they process it into like this incense, like
Yeah.
cotton, so to speak. Yeah,
Yeah, it's difficult to describe, but it's warm.
yeah,
And
right.
he said it produces infrared, because I was like, how does this actually work? And he's like, you asked too many of those questions. And he's like, no, I want to know, like science knows things now. And he's like, yeah, science doesn't know lots of things too. And I said, well, and he's like, well, the theory is that it does produce some infrared heat, and like if you want to bring Western medicine into it. But it was really cool and smells interesting too. So we're using acupuncture, herbs, diet, lifestyle, cupping. I think everybody knows what that is. Massage. I believe there's some energetic components or practices too, like qigong or tai chi or
Yes,
those.
correct. Yeah,
Yeah.
yeah,
And then,
both of those.
The moxibustion is cool, and we're going to talk today primarily about hormones and fertility related to traditional Chinese medicine. But before we jump into that, and that's your focus too. But what are the main, I guess, in the West? What are the main reasons people might want to, or that they do go see a Chinese medicine practitioner or acupuncturist?
Yeah, I think you mentioned earlier that Western medicine, conventional medicine as we know it today, has labeled us as alternative. So along those lines, I think the biggest population that tends to come and see us are those that have tried other more conventional modalities, like let's just say medication or surgery or PT or whatever it might be, haven't really achieved the results that they're looking for. And so then they're looking for something else that might, be successful for it.
So more so that demographic than a specific problem. It's
condition.
Then it's
No,
like
so I think that's
problems
a
haven't been
demographic.
solved.
Yeah, I think that's a huge demographic in whatever condition is there. But within conditions, we can really treat most things that you would go see your primary care physician for. And in California, we are considered primary care physicians and providers. But if there's an emergency, so the easiest way to say what we really can't help with in most cases is any trauma, immediate, acute, traumatic situation. So you wouldn't come to us, you'd go to the ER, right?
Yeah,
But
yeah.
afterwards, if you
Gaping
want to help
wounds,
with
broken
healing, yeah,
bones,
yeah,
heart
right,
attacks. Yeah.
right. But you have your bone set, wound is stitched up. You want
Yeah.
to come to us to help with the healing process. That's where you would come to us. So yeah,
Yeah. Okay. Yeah. I used to be a lot more black and white and a lot more harsh when I first got into the functional medicine world on attacking conventional medicine. And I never would go there. I never use it. And, man, my leg's broken or I'm bleeding out. I've been, I was in an
right,
accident. I've had some,
yeah,
I will be the first one at the door. My wife is a nurse. She worked in the ER for a lot of years. Like I could never do that, by the way, but I will be the first one at the door. And there's a time and place for medications. Like she has multiple autoimmune
right,
conditions that were very, very difficult to get under control. And there were times where she was in such excruciating pain that the steroids were the only things that controlled it for a period of time while we were working on the underlying root causes. And without those medications, her life was hell. So
yeah.
I'm a lot less black and white. I'm a lot more gray now. But for reversal of chronic conditions and symptoms and for building wellness, I don't think they have a lot to offer. It's a
100% accurate.
different situation.
Yeah.
All right.
And in the world that I live in, by the way, with reproductive health, hormones, and fertility, I think some of the best approaches in many cases, are an integrative approach where we're combining some aspect of both. Yeah.
Okay. Yeah, I feel a little more sane now. Maybe I got older, but I used to be all up in arms. And now I'm like, no. There's a place for everything, and there's benefits to it too. So let's get into fertility. Now, this could be fertility. It can be women who have really severe hormonal issues, either really severe PMS symptoms or erratic cycles or infertility, men, low libido, infertility, hormone imbalances. Like, let's just get into because the what I find so fascinating about Chinese medicine is the whole paradigm is different. Like the entire I don't know what to call it. Like the lexicon, the everything of this causes this, or this causes this, or this is a deficiency in energy in this meridian related to this organ that, according to Western medicine, doesn't necessarily even do the same thing. So, which at first was a big block for me. That was like a big thing because I was very like black and white, and I was trained at grad school in physiology, and like I was like, no, but the spleen doesn't do that. So like,
Right.
how is this spleen or how is this? And then there is no thing as a triple warmer, triple heater. Like it doesn't exist.
Triple
Like,
warmer.
and that guy in San Diego was so helpful for me because he was just like, dude, just shut up. Like it doesn't matter. Just listen. Okay. It's a different system and relearn. And so I started to relearn. So in regards to hormones and fertility and these kind of things, I guess I don't even know the right question to ask, but like I want to start that conversation. So somebody comes in and they're having obvious hormonal related problems. How is the Chinese medicine approach, acupuncture, herbs, anything else? How does that go? How are you going to work with them?
Yeah. So look, I think the theory behind Chinese medicine is completely different than the theories behind functional medicine, although I do agree that it was the original functional medicine because it's so comprehensive in the way it looks at the body. And it's very different than the way conventional medicine looks at things. Every issue, whether it's a broken arm, weak digestive, let's just say you've got IBS or you've got infertility, they all start to get broken down into a diagnosis or a combination of diagnoses within Chinese medicine. It's very rare, even though when you learn it in school, especially in the beginning and the way the textbooks are designed, it's very, to teach someone, you have to compartmentalize this. So like somebody has spleen qi deficiency, which is a weakness in the digestive system, or somebody has liver qi stagnation. And you have to compartmentalize. Most individuals have a combination of 2 or 3, maybe even 4 of these put together that make up who we are constitutionally. Okay. And so our job as a provider, when we are starting to look at a patient who comes through the door, is to determine first and foremost, what are those different diagnoses? How do they get put together? What's the most important? What's the foundational one? And then what are the ancillary ones that are making it worse or are being made worse as a result of the base diagnosis? And so that is done primarily through 4 main ways. We ask a lot of questions. So that intake form that is long and really weird, like the questions that we ask are strange when you're filling it out.
Yeah. I was kind of annoyed by it, to be honest, until she started then telling me things about myself that literally nobody else knew. And I was like, witch doctor.
Right. So they're weird questions. And most people say, I've never been asked questions like this or in the detail that you've asked it. And they're not asked just to make someone pissed off and, scratch their head like, what is this all about? There's reasons behind it. And those answers start to, direct us into a certain direction of like, which one of these systems is being impacted most and how is it being impacted? And then we will take someone's pulse. And the pulse gives us, it's not just about rate. There's 28 qualities that we are feeling for in the pulse to determine and confirm our diagnosis, and to also say, oh, maybe the questions we asked didn't tell us everything. The pulse is filling in some of those missing pieces that that they couldn't tell us that they didn't
you use
know
multiple fingers to do this,
so it's
right.
It's 3 fingers, so 3 positions at 3 depths is what you're feeling for. Yeah.
Okay.
On both wrists. So
yeah.
It's compounded.
He always my little, I call him my wizard, but the wizard in San Diego would do this to me every time I came in, and I was like, "What are you doing?" He's like, "I can't teach you how to do this in a 3-minute response to your question." Because I was always so curious, because everything was so weird, and then he would do that, and he'd be like, have you had something happen this week that's out of the ordinary? Like, he would be able to, because he could tell from the last time I was in that something, some symptom of mine had shifted or something. And so he's like, just let it be.
We'll just let it be. Yeah. And we do the same. We do the same thing with the tongue. So the tongue is an organ, and we're looking at, just like we would look at the skin in someone's face and body. So I was saying there's 4 things. So the tongue is 3, and looking and palpating at the body is number 4. And so we would look at the tongue. How does it look? What's the geography? Color. Is it dry? Is there a lot of coat on it? Are there markings? Are there places that are, discolored or puffy in relation? And so all of that also confirms, because each part of the tongue is associated with a different part of the body. Mm-hmm. So we bring all of that together to create this diagnosis for somebody. And that's how we pull that together. And so based on that diagnosis, then we're saying, what can we do through acupuncture? And what can we do through these other modalities, Chinese herbs, moxibustion, whatever else we might need to incorporate? And that's how we create this, treatment plan, so to speak, of how we're going to combine that for an individual to get the best results.
And diet and lifestyle things can be used to, I don't know the right word, manipulate or shift those imbalances as well.
100% diet's such a big part of Chinese medicine. And it's why, like, you might hear your acupuncturist or Chinese medicine doctors saying, oh, I don't want you to eat cold things. I want you to eat warmer things, or I want you to stay away from spicy foods, or whatever it might be that they're telling you. It's all in relationship to that diagnosis, or I want you to eat more spicy foods, right? Just depending on the circumstance. Yeah.
Interesting. I always got given, he'd always apologize to me for the herbs he was giving me, because they were like the most noxious, bitter, awful concoction of things. And I just thought it was punishment half the time. But he's like, you keep coming up for this, so until something shifts, this is going to be your jam.
This is what we need to do.
But then the dietary stuff, I was like, but I like that. I always want that. He goes, I know. And that, so
We need to take it back a little.
Yeah,
bit.
yeah,
Take
we
it
need
back.
to draw
Yeah.
it back. Yeah, so it was interesting because there's like dampness and cold and warm and heat
Right.
and different and the foods and make sense and the like when you look at it from that, like of course you
Yeah.
want to,
Yeah. Yeah.
if you're cold then eat
Absolutely.
more warm things, if you're run warm
Right.
eat more cold things or fresh things.
Yeah, and by the way, someone's diagnosis is also going to be influenced by their environment. Someone who lives in San Diego, a much drier climate, will be influenced, and their diagnosis we tend to see more of dryness. Whereas someone who lives in a hot, humid location, we're going to tend to see more dampness or damp heat in those areas, especially at certain times of the year. So it's not just our constitution; it's also the environment that impacts us.
So you're from Miami, you said?
Yeah.
Yeah, that's a very different
Very
environment than
different.
San
Yeah.
Diego.
Yeah. This
Anybody who's
suits me
never
better.
been to either thinks they're really similar, probably. But then anyone who's been to both knows that they're like polar opposite places in weather and in a lot of things. But that's interesting that we pick up from the environment. But of course we do.
Yeah, absolutely. And that's actually why I chose those two things to compare. Because when I was in Miami, it was a lot more dampness. And I felt that more in my digestive system. And when I moved to San Diego, it's a lot more dry. And it improved just by environment, improved my digestive system. Yeah, for that matter.
That's interesting. And
Yeah.
I noticed what felt good to me shifted when I moved from Chicago to Southern California as well. Like the foods I wanted, the things that felt good to me, everything kind of, not immediately,
Sure.
but within a year or so, I had way different preferences for those things. So
Yeah.
then in regards to something like hormone imbalance, or because the paradigm or the theory, the paradigm, the whatever you want to call it, is so different, are hormones actually even part of traditional, like the Chinese medicine, like world?
Yeah. Yes.
Yes.
However, when Chinese medicine, the theories were originally created,
Yeah, we didn't know that
know,
stuff.
correct, centuries ago, it wasn't part of it, right?
Oh,
They
okay.
came up with, and then when they found out, oh, there are hormones and there are nerves and there's these things. Oh, how do we then correlate those things within the framework that we have within Chinese medicine? And so that's how we started to work
Okay.
to associate them. So yes, very much like estrogen and progesterone and testosterone, these are all absolutely correlated within Chinese medicine. Now, every hormone, maybe not, right? But most of the more prominent hormones, absolutely. But for instance, like you could have a woman who is having fertility struggles, and let's just say easy conversation. Someone who has PCOS, a woman with polycystic ovarian syndrome. Okay. And then you could have another woman who is not infertile, but has digestive issues. The two of them could have the exact same diagnosis
In Chinese
would be
medicine, like of the
in Chinese
imbalances
medicine.
in the energy. Yeah.
of the imbalance. Yeah. And would be
Okay.
treated very, very similarly. The
Okay.
differences would be, oh, this is a digestive issue and this is a PCOS. So we're going to adjust some of the points and we're going to adjust some of the herbs in the base protocol for each one of those things.
Okay.
Yeah.
But yeah, that's what I was going to ask, but I wasn't sure how to language it. It was like, can two people presenting with different symptom profiles have the same imbalances, or could two people presenting with the same symptom
Diagnosis.
profile have the same symptom? Two women come in with PCOS,
Yeah.
and one of them has a wildly different diagnosis than the
Correct.
other.
Yes,
And-
absolutely. And that happens as well.
Okay, so it's a lot more about then looking at your diagnostics and the where does she fall in the Chinese medicine
Yeah.
diagnoses, not so much what symptoms are being presented or what labs do I have that show what things or whatever. Like
Yeah.
I'm sure it all helps, and now the way everything's kind of, I don't know whether I'll use a scientific word, getting mushed together. There's probably aspects of different modalities and practices kind of intertwined a little bit, but so it's the diagnoses often exist outside of some of the same framework that we would think of from a Western or conventional, like
100%.
That's
Yeah.
fascinating.
So yes, that's completely accurate. I can have 10 women in the room, all with PCOS, and they would all be diagnosed slightly differently from one another from a Chinese medicine perspective, because it's about diagnosing the individual in front of us, very much like functional medicine, just in a different way. Right. And so like within my practice and the way I support couples, I combine both. I'm diagnosing an individual based on Chinese medicine in front of me. I'm diagnosing them based on functional medicine with all the labs. And then I'm integrating those together to determine what am I going to tackle with one, what am I going to tackle with the other, and how are we going to put those all together.
It makes a lot of sense. And it is more similar than different, because there's a lot of different root causes and drivers of PCOS or hormone imbalance in the first place. So
Right.
if, two people, one guy that has low testosterone works a night shift, and the other one sleeps normally but has a completely sedentary lifestyle and doesn't do any workout or exercise at all. They could both have low testosterone, but the thing that's pushing them towards it is completely different.
Completely different. Yeah.
So then the recommendation would be completely different, just like this. So it's I'm trying to
there might
make
be a small
parallels to,
overlap. There might be a small overlap, but in general, yes, they're going to be approached differently.
Yeah, you need to get your circadian rhythm in order, and you need to move your body. That's completely different things. So,
correct.
Okay. Doing this via distance, I joked before we went on air. I said you can't stick needles in people from the internet yet. I'm sure that that's coming somehow. But some bodysuit connected to some VR, connected to something. I'm sure. Give it like 10 years, and I'm sure it will exist. But as of right now, you can't do. But there's things other than needle. There's acupressure. There's and I don't know. I'm no expert, so I just know that there's multiple ways to stimulate acupuncture points than just needles. But how does this work via distance? Does it work?
Yeah. So obviously, from a distance, you're not putting needles in somebody, and I would never train someone to use needles at home on themselves. It's too dangerous. I have an online coaching program, and when I started it, I said, well, I asked myself this exact same question. What am I going to do for this piece that I obviously can't do for somebody who's local? So I do a couple of things. One is I created all of these tutorial videos to support them, to allow them to find the points to do acupressure at home. And whether that's, using your finger to provide the pressure, or using some other tool, to provide the pressure. And there are these like little acupuncture seeds. There's like little seeds that acts out of like a Band-Aid essentially.
Yeah, I've had somebody stick them in my ears before.
In the ear, right. Yeah. So you could use those as well. So I created these tutorials within my program, and I say, this is what I want you to follow. And then they see the videos and they put the points there, and then they massage them. So that's one way of doing that. And by the way, with that, they can also, I teach them how to do moxibustion at home as well. And they could, support those points in addition, not just with acupressure, but with moxibustion. So that's one way, and that's totally feasible, safe, and realistic to do. But for those who I think acupuncture is going to be better for, and acupuncture allows you to stimulate those points and those systems more continuous over a period of time, and it's much easier to stimulate that point for 30 minutes or 40 minutes while you're getting acupuncture than it is constantly pressing the point.
Yeah.
So it's different. So for those individuals who I think really need that, then I want to have the conversation about how can we find you a good acupuncturist, one who's trained in what we need and safe. And so there are ways to go about that. One of my favorite resources, especially for fertility and reproductive health and hormones, is there's an organization, you mentioned it in my intro, that I used to be the president of, and I'm currently a fellow of, ABORM, the American Board of Oriental Reproductive Medicine. And that website is aborm.org. And all of these individuals, first and foremost, have had to have been in practice for a minimum of 2 years. So they couldn't just graduate, hang their shingle, and say, I'm a fertility expert. I mean, they can, but if they don't have this, certificate, they can't use that. They had to, study for roughly a year to sit for an exam that tests their competency both in Chinese medicine and in artificial reproductive technology, so IVF and IUIs. And so they understand how to do them individually, how to integrate them, how to work within that framework, and how to support you both with acupuncture and herbs. And so that's my favorite resource. Most of those providers are in North America, but there are providers throughout the world. More in, like, there's a handful in Germany, I think a couple in Italy. There's they're spread out, but the majority of our North America. And I think that's an amazing resource for everybody, because you can trust those individuals and their knowledge.
That's really good to know. And thanks for sharing that and for helping organize it and make it what it is. Because that I think that's when trying something new, I think that's what holds a lot of people back, is you don't know what you don't know. Like, I don't know how to tell a good mechanic because I don't know a damn thing about cars. So I can go to any mechanic and they can tell me 27 different things are wrong and it's going to cost $6,000. And I'm like, oh man, that sucks. But like, I wouldn't know that all I needed was to like change an air filter. So it's really helpful to have organizations like this that can help vet people. I'm curious how your diagnostics work via distance, because you can't take your own pulses probably. So how do you, is it more a questionnaire situation? And like, well, they can look at their tongue, but if they're not sure, like, how do you do diagnostic in a distance situation?
So I use a lot of questions in questionnaire, and that really puts me in a certain place. Obviously don't use pulse, but I can see people. And so that gives us, quite a bit of information. We use the tongue when we need to, like, I'm trying to clarify between one thing or another, so I'll use the tongue in that situation. But from a distance, I rely a lot on labs, and so I'll lean a little bit more heavily on my functional medicine background versus my Chinese medicine background in that regard. But I'm still utilizing herbs, still recommending, protocols and so forth based on Chinese medicine. Yeah.
Okay. And you mentioned that these things, especially practitioners trained through that organization, know how to complement more conventional approaches to fertility, things like IVF and hormone replacement and that type of stuff with Chinese medicine. These are compatible approaches?
Yes, absolutely. About 50% of the couples that we support are going through either an IUI, so intrauterine insemination, or IVF, in vitro fertilization. And we integrate with them tremendously. One thing I want to really, really mention, and I think it's really important to know, it's not just that traditional Chinese medicine was used traditionally and anecdotally for fertility. It was, and that's how we came to this place to begin with. But there's a tremendous amount, especially currently, a tremendous amount of research that was done in the last 25 years around utilizing more specifically acupuncture. But in the last 10, we're seeing a lot more with herbs. It's just a little bit trickier to do that research. But there's a tremendous amount of research that was done incorporating acupuncture with IVF and in different parts of the IVF process. And in almost all of those research studies, we see a benefit, meaning an increase in success rates for those individuals who do incorporate it. Some are just incorporating at the last time where they have an embryo and they're about to put it into the uterus. So they're just incorporating at the transfer day, which shows a nice increase in success rates. Other research is showing that if you use it for a period of time, which is what we typically want to see, that if you're using it for about 12 visits, that you will see also an increase And there's all other types of research that was done. There was I think 2 amazing research studies done. The woman who founded it was somewhere in Europe, I can't remember where, and around PCOS, showing how impactful acupuncture is to improving PCOS and regulating cycles and ovulation. So it's not just this like woo-woo thing that was done and, oh yeah, they said it was good and we have this. There's a lot of research done to support it now that really shows its benefit in integrating with, traditional or more conventional fertility treatments.
That's great. And I know that matters more to some people than others, but to the people that it does matter to, it's super important for them to see that and hear that. I've shifted from being on the extreme of that end of the spectrum to being on the extreme other end of the spectrum personally. But it's really good to see, and to see it get validated, and have it be more widely accepted, because the more studies, also the more conventional medicine practitioners will invite it as well. Like fertility doctors and things like that will be like, hey, just to consider, this can increase your chances of success here. And for a lot of them to say that to their patients, they need to see those things. So
and that's why they were done. Things that are driven within this space are a lot driven by the consumer. So when the consumer sees these things and hears about it, then they push for it. And that, so it's a blend of those things. I work with every fertility clinic in San Diego, integrating with their patients and supporting their patients through IVF. So, some clinics more open than others, but, most clinics understand the research and are wanting to integrate it for their patients.
That's fantastic. And before we go, I just want to make sure that we've talked a lot about the ladies. This can be helpful because there's a presentation in this masterclass from Dr. Jerry Bailey on men's health and men's hormones, and it's pretty frightening, the trends that we're seeing with testosterone levels dropping, sperm counts dropping, infertility issues rising, like all, et cetera, et cetera, et cetera, et cetera. And for the guys out there, what do you got to say to them in regards to trying this avenue as well?
Yeah. Well, first I should say Dr. Bailey's awesome. I know him personally. He does great work. And also an entertaining guy. But
super fun.
Aside, super fun. Yeah. But that aside, I will say that 50% of all fertility issues are male factor related. Even miscarriages, 50% of those are attributed to men. And so we can no longer, as men, hide our head in the sand and ignore our responsibility in this piece. And as such, I will say that we work and support men and see amazing results with men, often much faster. We can see that much faster. And so there's really no reason not to integrate Chinese medicine into your approach. It's profoundly effective and safe, and something you should really give a try. And most men actually really need that time to reset, relax, and rejuvenate. And so that's an opportunity during the week to do that as well.
That's awesome. Yeah. Dr. Jerry, his was like a really awesome, in-depth presentation mixed with a heavy dose of laughing and silliness, because I don't know if he can present in any other way. And he's top notch. Like he presents to doctors all over the world. Like he's this, but it can't not have humor in it. So it was a lot of fun learning about how tanked men's hormones are and what we can do. And So and then my last thing is just personal to anybody out there who also has I'm a paradox, because I have tattoos, and getting tattooed doesn't really bother me, but syringes and needles, I had a traumatic experience when I was a kid with an IV. Like I was terrified to go do I remember sitting in her office. She was asking me all those questions, and I was all sweaty and clammy and nervous and whatever, because I knew what was coming. So it was double whammy. And most of my experiences with acupuncture, I've now probably had 30 treatments, or I don't know. So I'd say over 90% of the needle placements were relatively, I barely even noticed them. Occasionally, there's a couple spots, which I've learned is actually not uniform to everyone, but there's a couple spots on my body that don't necessarily like the needles as much, but it pales in comparison to like I have to go. I'm having a medical phlebotomy done next week because I have hemochromatosis, and having that condition for someone who has a huge needle phobia is like a sick cosmic joke.
Oh, yeah, it
And
is.
it's only the second time I've gotten myself to go do it, but I probably will pass out. I probably will feel terrible. And even blood draws for blood lab testing is a big ordeal and whatever. And acupuncture is like peanuts for me personally compared to those experiences. So if you haven't tried it because you're scared of it, let the practitioner know too. That's important, I think. And they've all treated me really well. And it is not super scary and super painful.
100% agreed. I promised you wouldn't be the first person that walked into our office and said, "I'm nervous, I'm scared of needles." And we're used to it, and we can accommodate those things. So let them know.
Yeah, it was fine. And well, this was great. I'd love to connect again in the future because there's a lot more rabbit holes I'd like to go down with this. I took a lot of frantically scribbled notes, but I'd love to connect again in the future and learn more. And we'll have the links and everything. We named it at the beginning during the intro, but we'll have the links where people can get to them to get to your website. Check out your group programs, your practice in San Diego. We'll link the organization for finding practitioners. But thanks so much. It was really, really, exactly what we were looking for to help people kind of get their foot in the door to understand this better, to be able to implement this in their own hormone optimization journey.
Well, thanks for having me. I appreciate it. And I welcome, any future conversation as well.
All right.